If you've been wondering if that gnarly back pain that you have been dealing with on and off for years, the sciatic nerve symptoms, disc problems, if you've been wondering if all of that could be affecting your bladder leakage, you're in the right place. My name is Brittany Cappiello, and I am a pelvic floor physical therapist who's devoted the last 21 years of her career to helping women just like you. And I hear this question a lot. I've had low back pain for a while. I have degenerative disc disease. I've had sciatic nerve symptoms. Does that have anything to do with my bladder leaks? This video could be super short and quick. The answer is yes, absolutely. But let's explain it a little more and go beyond that, okay? The cool thing I like to tell clients when I'm working with them one-on-one is that when we figure out what is going on with your bladder, if it really is because of how you're moving that's influencing your back pain as well, we actually can kill two birds with one stone. So the same exercises that are going to help your bladder leaking are often also going to help your low back pain. Now, there are certain cases where trauma has been a factor in back pain, motor vehicle accidents, surgeries, things like that. Now, I will say that we can't always fix all of those things, but if you have generalized low back pain, aches, pain, SI joint discomfort, just wear and tear over time, learning to move your pelvis and your hips better will help that and your bladder leaks. So let's take a quick look at the pelvis. And we talked more in detail about the anatomy of the pelvic floor in our Pelvic Floor 101 video. Check that out if you want more details. But for the basis of this video, let's take a look at the anatomy of your back and spine in your pelvic floor. So this would be looking at somebody's spine from behind, or their pelvis from behind. So if they were standing in front of you, this is their sacrum, which is the largest lower part of the spine. And then this is the lumbar. This is L5, which is the lowest part of the lumbar spine. And then you have lumbar, thoracic, cervical that go up above it, okay? These are your pelvic bones, okay? This is your coccyx or your tailbone, which is the very lowest part of your spine. Often your coccyx can be fractured during labor and delivery, can be fractured during a fall, whether that's fall on ice, fall on concrete, fall off a horse, whatever it may be. Very easy to fracture and bruise your tailbone in one of those types of events. So let's talk about back pain related to the pelvic floor. Your pelvic floor, that's these muscles right here, literally surround your coccyx and your tailbone, and they attach directly to the sacrum, which means that anything happening down here is going to affect that entire chain up above. Think about it like this. If I pull on my shirt here, okay, you can see the whole shirt moves, right? It's not just moving where I'm pulling. You see it move across my chest. You can see the lines pulling across my shoulders. And then when I release it, everything settles back down, right? So pull, everything gets pulled. Now, if your pelvic floor is tight and it's pulling on the lower part of your tailbone and your sacrum, guess what that does to everything else up the chain? It pulls and it changes the mechanics of how your spine is working. So pelvic floor dysfunction, pelvic floor tightness, tension on one side or the other or both can lead to SI dysfunction. It can actually make symptoms in your low back worse because you may not move as well, which might mean that that wear and tear starts to occur a little bit more rapidly. It also means that if we get you moving better through your pelvis and we reduce the tension through your pelvic floor, that we release this tension just like we release the shirt and things start to settle back down. Now, we can't reverse what's already happened, but we certainly can slow down any potential progressive worsening over time, right? So, pelvic floor dysfunction, pelvic floor tension is absolutely influenced by what's happening at your low back, and your low back is absolutely influenced by what's happening with your pelvic floor. The other factor that I want you to think about when it comes to the relationship between your back and your pelvic floor is I want you to think about pain, right? Pain is a huge dictator in how we move. If we have a lot of pain, are you wanting to move more or are you wanting to move less? Most of you are going to say less. That big motions don't sort of seem like they're comfortable. If you move, you might be a little bit guarded, taking smaller steps, being a little more cautious, going a little slower, not moving with the same amount of speed. You may be very careful of sort of quick initiating motions. And now I want you to think about what we learned about in that other pelvic floor video, about the importance of moving when it comes to your pelvic floor. When you look at your pelvic floor muscles, remember we talked about this, some of the muscle fibers run with rotation, some run side to side, and some run front to back. which means to get your pelvic floor working and get your pelvic floor strong so it supports your internal organs better, so that it helps stop bladder leaks and incontinence, your pelvis has to move a lot. Well, if your pelvis has to move a lot, that means your spine has to move with it. And if pain is not allowing you to move, your pelvic floor starts to shut down. When your pelvic floor starts to shut down because it's not being moved, your pelvic floor muscles start to get weaker. You start to lose strength in your pelvic floor muscles. You start to get less blood flow into your pelvic floor muscles. So they just start to tighten, compress, and weaken. So there's a huge relationship between how you move and what's happening at your pelvic floor and what's happening at your spine. So you might be thinking, well, Britt, that's really great. I know I have to move more to help my pelvic floor, but movement scares me when it comes to my spine. Well, that's when we talk about the right kinds of movement, okay? I'm not talking about, oh, it hurts to bend forward, we'll do 20 repetitions of those. That's crazy. If you know something hurts, moving in a way that you know hurts and inflaming and irritating the tissues isn't going to help your bladder, and it's not going to help your low back. But what we can do, and what we teach in my online program, in the live workout classes that I do, what I teach members when I work with them one-on-one, is how to move where your low back moves with your pelvic floor. Your low back doesn't dictate the motion. There's a really big difference there. When your low back dictates motion, your low back tries to do everything, and that's when the pain often will worsen. But if your pelvis is moving and your low back is just coming along for the ride, it reduces a lot of stress, inflammation, and irritation to both the joints of the spine as well as the muscles and the soft tissue around it. So big relationship between low back pain and pelvic floor dysfunction, specifically incontinence, pelvic pain, prolapse. Those are big ones that are influenced by low back pain as well. Learning with a pelvic floor PT how to move appropriately, how to move the right way, can really improve your symptoms, both from a leaking standpoint, from a prolapse standpoint, from a pain standpoint, and it can actually help to reduce your low back pain as well, because if something hurts, continuing to irritate it just continues to increase inflammation and soft tissue tension and pain. And so if you can learn to move properly, reduce the stress on the low back, you're actually going to find your low back starts to heal, that symptoms start to feel better, and you can conquer two birds with one stone. Check us out at mycorefloor.com to learn more about the exercises that are right for you with your low back pain and your pelvic floor problems. We can help you.